Ladies and gentlemen, please welcome Saartje Uyttebroek.
Hi. Hi, welcome everyone. Thank you very much for this kind introduction. So before we can have a wonderful lunch, I will dive with you into the world of bacteriophages. But first, who am I? Let's get to know me a little bit better. So I'm actually based in Leuven. I studied medicine first in Diepenbeek in the University of Hasselt, and then I went to the University of Leuven. And now I'm a resident doing a residency in ear, nose, and throat diseases. But I'm also doing a PhD in Leuven on phage therapy and things like that. So please, everyone, if you have any questions about doing a residency, doing a PhD as a resident, you can always ask me later. Before we get started, I would like to tell you something about the papers that you got on your chairs. So most of you will have a red one or a yellow one, and then a whitish green one. So we will use that later on to do some questions and things like that. So has anyone a card? 2 of them? Okay, everyone has it. Okay, perfect. All right, so let's get started. 700,000. That is the number of people that die worldwide each year because of antimicrobial resistance. They even expect in 30 years that this number will rise to 10 million each year. If you think that's only a problem in the rest of the world, well, that's not the case, because in Belgium as well, they think that each year 22,000 people will die because of antimicrobial resistance. And the healthcare costs even will sum up to 24 million euros, which is actually extremely expensive. So, but what is antimicrobial resistance? So, normally when bacteria grow, for instance, Staphylococcus aureus or Pseudomonas aeruginosa, some germs that you might have already heard of, usually when we give antibiotics or other disinfectants, these agents will die. But unfortunately, these bacteria, they have mechanisms to overcome dying. So they have like mechanisms including producing enzymes. They can just throw the drugs away from the bacteria. They can modify their target, so they have several escape mechanisms so that antibiotics will not work anymore. We also heard that antimicrobial resistance is a big trouble because, yeah, people get lots of antibiotics, they don't do the entire course, so it's really a big trouble. And then these troubles begin to start. So there are superbugs coming. So we already heard about the MRSA bacteria, also the Pseudomonas aeruginosa bacteria. We also have like some terrible E. coli that are ESBL producing. So they're really, and we don't have anything to do about it. So it's really a big issue. So what else? Yeah, we can make new antibiotics, but that's really not, that is quite impossible because it takes a lot of time, it takes a lot of money. It's very difficult to really find new antibiotics. So what should we do now? So scientists are actually looking for an alternative to treat these bacterial infections, but it's really difficult to find a solution. So this is where I actually want to introduce the concept of bacteriophages, we call it phage therapy. So let's try this one. So you have a card, a white or green, and a yellow or red. Has someone already heard about bacteriophages? Please raise your papers up. All right, so I think almost everyone has heard of phages, so that makes it easy for me. All right, so then a more difficult question. So which one do you think is a bacteriophage? Do you think it's the left one or it's the right one? Which one is the bacteriophage? All right, perfect, perfect. So it is true. So this one is the bacteriophage, and there is the bacteria. So they're actually enemies of each other. What is a bacteriophage? It's actually a virus, And they are present everywhere in the world, so they can be found in different sorts of materials, which I'll come back on later. But bacteriophages are viruses that are actually able to destroy bacteria. They are everywhere. They are even found in the body. Okay, so how do they look like? They have actually almost all the same shape. They have like a head. They have like DNA or RNA inside their heads. They also have a color, we call it. They also have a body and a tail. And the phages can be divided in separate groups depending on how they actually look like. As I already mentioned, phages can be found in the soil, also in wastewater, in foods that we eat, but also in the human body. Just a fun story, when we are looking for new phages, we have like this pond in front of the hospital where we can take on rubber boots and we dive into the water, and there we can find new phages. But sometimes when we are looking for phages, we can find them inside someone's nose, that we just take a brush and that there are phages right there. So they're everywhere, and their function is to, in the nature, to have like the equilibrium, the balance between bacteria, that they're not everywhere. So that's their actual function. All right, so how do phages work actually? So here you can see a picture. A phage has one bacteria, so the phage attaches to the bacteria. They can insert their DNA. They can produce small bacteriophages inside of the bacterial cell, and then they produce enzymes so that the phages will go outside the bacterial cell, they destroy the cell, and then they move on to the next bacteria until actually all the bacteria are gone. So they just jump from one to another, they do the same thing, they insert their DNA, they produce phages, and then continue to the next one. And that is actually, we call this one the lytic cycle. So these are phages that are able to lyse bacteria. There are also some phages that do some other things. So they are able to inject their DNA, but then they integrate their DNA in the DNA of the bacteria. They stay there for a while. They can divide within the bacterial cell. And then when something happens, like a change in the environment, they are able to as well do the same thing, produce little phages, and then go on to the next one. So these are the two types of phages. We actually don't like the lysogenic phages, so the phages that stay within the bacteria. We don't like it to do it on patients because then they will stay there and we don't know really what happens. So when we want to use phages, we will use the lytic ones. So phages, what can we use it for? So we can first use it for to treat bacterial infections in human. But we can also use it to treat infections in veterinary medicine, so veterinary medicine, so in dogs and cats and things like that. But also it's used in agriculture. For instance, there's something like, we call it the hairy root disease in tomatoes. So sometimes there's like a bacterial infection on tomatoes, which causes like the whole harvest that had to be thrown away. So now they're doing tests to apply phages to it so that the tomatoes won't die and that we can harvest them. So that is also something that is routinely used. But also, like, as I already said, in the food industry, it's also very commonly used already. So phages is more than human body only. So another question for you guys. When do you think was the discovery of phages? Do you think that it was in 1915 or do you think it was in 2013? All right, I see a lot of different answers. Well, they were discovered already in 1915, so it's very, very old. So there was this one British guy, his name was Frederick Twart, and he saw when he was doing his experiments that there was like something invisible that was really damaging his bacteria. And he didn't know what, but he saw that the bacteria disappeared. But unfortunately, the World War was there and he had to stop actually his research, so it ended there. But at the same time, there was this French guy, Félix Zerel, who also had the same discovery. So he also saw, well, there's something wrong with my bacteria, with the Shigella it was. And he saw, well, these are not growing, so there might be something going on. And then it was only in 1928 that you already saw it probably in the medical challenge. So that this guy, so Fleming, discovered penicillin, and then the antibiotics came up. So actually, we know the phages before we knew the antibiotics. But then, after the discovery of the antibiotics, something happened in the world. So our world was divided actually in two parts. So first, we have like the Western Europe and the States. There we had the discovery of antibiotics, everyone used it, but then quickly we saw that all these bacteria became resistant. But on the other side of the world, like more in Eastern Europe and also in Russia, some parts, they used also antibiotics, but they also used phages to treat patients. So there they have really, really a lot of information about the phages. They use it a lot. You can just go there over the counter, order phages as we do with antibiotics. So they have really a lot of experience with it. But because it's so far away from us, we didn't get the information. So just to have a more look, the most important center for the phages is located in the Uyttebroek Institute in Georgia. There they have like an entire library with phages. There you can just, when a patient needs phages, you can go there, order them, they drink it, they put it in an IV, they use it for several things. So here's a bit more how it looks. So this is the Uyttebroek Institute in Georgia, and this is actually how such a phage looks like. So they come in liquids. Sometimes they even do it on different methods. Here I have a small video to really have a look at phage therapy. So it's like an introduction to how the things work in the Uyttebroek Institute, also with some more background information.
ყველაფერი 1923 წელს დაიწყო. მაშინ, როდესაც პროფესორმა გიორგი ელიავამ ფაგების ერთ-ერთ აღმომჩენთან, კანადელ მეცნიერთან, ფელიქს დერელთან ერთად ფაგების კვლევისა და გამოყენების მსოფლიო ცენტრის შექმნა გადაწყვიტა და მიკრობიოლოგიისა და ვირუსოლოგიის სამეცნიერო კვლევითი ინსტიტუტი დააარსა. მრავალწლიანი ტრადიციები დღესაც გრძელდება. ფაგებთან დაკავშირებული ნებისმიერი სამეცნიერო კვლევის პროცესი, ფაგების გამოყოფა, შერჩევა და შესწავლა სწორედ ამ ინსტიტუტში მიმდინარეობს. ელიავას ინსტიტუტს აქვს მსოფლიოში ბაქტერიოფაგების ყველაზე დიდი და ფასეული კოლექცია, რომელსაც ინსტიტუტი 10 წლეულების განმავლობაში ქმნიდა. ფაგები დედამიწაზე ერთ-ერთი ყველაზე გავრცელებული სიცოცხლის ფორმაა, რომელსაც ბუნება ეკოლოგიური ბალანსის შესანარჩუნებლად იყენებს.
ფაგს ანტიბიოტიკისგან განსხვავებით აქვს რაღაცა გარკვეული უპირატესობა, იმიტომ რომ ის არჩევით მოქმედებს ბაქტერიაზე, ესე იგი, კარგ ბაქტერიებს არ კლავს, არ მოქმედებს მასზე, ანადგურებს მხოლოდ ცუდ ბაქტერიას, იმ ბაქტერიებს, რომლებიც იწვევენ დაავადებებს.
ელიავას ბაქტერიოფაგების კონსორციუმში ინფექციური დაავადებების მკურნალობა ფაგური პრეპარატებით, ერთი ფანჯრის პრინციპით ხდება. ელიავას საერთაშორისო ფაგოთერაპიის ცენტრი პაციენტებს ამბულატორიული ტიპის კლინიკურ მომსახურებასა და ბაქტერიული დაავადებების ფაგების საშუალებით მკურნალობას თავაზობს. ამ ცენტრს მთელ მსოფლიოში იცნობენ. უშედეგო მკურნალობის შემდეგ უცხოელი პაციენტები საქართველოში სწორედ ფაგოთერაპიისთვის ჩამოდიან.
The problem is I have for more than 25 years chronic inflammation in my nose, ear and throat. It's called rhinitis.
დღევანდელ ეპოქაში, როდესაც ანტიბიოტიკო რეზისტენტობა ძალიან მნიშვნელოვანი პრობლემა დადგა ჯანდაცვის მსოფლიო ორგანიზაციამ ამ საკითხზე არაერთი მნიშვნელოვანი განცხადება მიუძღვნა და ჩვენ დიდი იმედი გვაქვს იმის, რომ ფაგოთერაპია ეს იქნება სწორედ ერთ-ერთი გამოსავალი აი ამ ძიმე მდგომარეობიდან.
It starts healing inside in here. And the phagen therapy is wonderful. I think it's wonderful.
ელიავას ბაქტერიოფაგების კონსორციუმის სადიაგნოსტიკო ცენტრი ბაქტერიოლოგიურ, ვირუსოლოგიურ, იმუნოლოგიურ, ბიოქიმიურ და ზოგად კლინიკურ კვლევასთან ერთად პაციენტებს უნიკალურ კვლევას თავაზობს. კერძოდ ინფექციის სამკურნალოდ ფაგების შერჩევისათვის მგრძნობელობის დადგენას. ცენტრში დიაგნოსტიკისთვის თანამედროვე ლაბორატორიულ აპარატსა და უახლეს ტესტ სისტემებს იყენებენ. ელიავას ბაქტერიოფაგების კონსორციუმის
All right, so now you have an idea. So the Iliava Institute, they have really massive knowledge on phages. They use it every day in patients. But here in Western Europe, it's really something that we don't know anything about in the past. But then in 2009, in London, they did the first randomized controlled trial with phages. So it was actually the first time that they set up a clinical study to really evaluate how good that these phages work. So it's really lots of years after that the Iliava was built. So, and here are the results of the trial. So they had patients with an ear infection for several years. They were infected with Pseudomonas aeruginosa. They have tried different types of antibiotics and it didn't work. And then they applied for one time, so it's only once, applied eardrops with phages, and they really saw massive improvement only after one application. So it's really something special. Then a question for you. So we've seen all the news about Iliava. Do you think that these phages are available in the rest of the world? Then we have yes and no. All right, so for this one, there is no good or false answer. So there are different countries working with phages, setting up phage libraries, treating patients, but it's really something that is not fully implemented in practices. For instance, in Portugal, they have like laboratories with phages, but they are not allowed in hospitals to treat these patients. So every country has their own rules about it. When they want to use phages, they have like a specific setup to do so. So they can do it with, this is like a law thing, so the Declaration of Helsinki, it actually states that if a patient is treated with all different things, they have like a severe infection and no antibiotic work, then we can use phages as like a compassionate use setting, and they call it also for an unproven intervention because we don't actually know a lot about these phages. So in a lot of countries, they're starting to build up phage libraries, they're starting to treat patients, but it's really not something that is really implemented yet. And then what do you think about Belgium? Do we have phages, yes or no? All right, I see a little bit of green, a little bit of red. Well, in Belgium, we have our own Iliava, a small Iliava center. So you might have already done the military challenge. Well, in the military hospital in Uyttebroek, they already have a phage library. They also have an extensive lab. They're doing lots of tests already. So they have their own collection of phages that can be used to treat patients. We have also something very special in Belgium. So I already mentioned that in the other countries, they cannot really treat patients with phages because it's not regulated yet. But we can, in Belgium, we can treat patients with phages. They have to stick to several rules, but then we just can give it to them as a magistral solution. So the pharmacists have to make like a cocktail and then we can give it to the patient. So it's really something new in Belgium. We also, I work at the University Hospital of Leuven. There we also have, we call this the Phage Force project. So patients with very severe infections and then mainly musculoskeletal infections, pulmonary infections, sepsis, and chronic rhinosinusitis, we can treat these patients with phages, but they have to be infected with a type of bacteria. They have tried several antibiotics, and then we can give these patients a local treatment with phages. In the end of the talk, I will just give you an example of a patient that we already did. So another question for you. Do you think that phages cause any side effects? All right. So phages are something very particular. So how does it work? So there's a phage, it binds to the bacteria, they grow within the bacteria, and the bacteria is gone. Phages are not able to bind on a human cell, so it normally shouldn't cause any side effects because it's really not touching anything of the human body. It also works different than antibiotics, so that is another advantage of phages. So, for instance, Staphylococcus aureus, we call it MRSA, that has beta-lactamase. Well, they are typically resistant to a lot of antibiotics. But these phages, they work differently. So they bind to the cell. It doesn't matter if the antibiotic resistance is present or not. So that is really another really good advantage of the phages. Another advantage of the phages is that we can just find them everywhere in the world. We can find them just in the soil, in water. So it's very easy to find new phages. This is in contrast to antibiotics, that it's really difficult to find new ones. Then another advantage of phages is that they can really destroy the biofilm. So a bacteria can produce a biofilm, and these phages are able to really destroy it. So that is also something good. And then lastly, they are able to replicate within the cell, depending on how much bacteria are needed. And then when the infection is gone, they just disappear from their cell. So they really change depending on the bacteria. They also have some disadvantages, of course. So because they are just specific to one bacteria, they don't have a very broad spectrum, so they can only work. I'm trying to use my pointer. Yes, that's better. So they have like a narrow spectrum, so they can only work to several bacteria, but you can combine phages to really broaden the spectrum. They also, we don't actually know how good it works, so we cannot say if we use that treatment, then this will happen, so it's really a little bit unpredictable. And another disadvantage, of course, is that they have like very limited frameworks, that it's really difficult to treat patients in a hospital with phages. Then we have another, all right. If we compare it to antibiotics, we know antibiotics have a broad spectrum. We know lots of it. We have studied all the pharmacology. There are lots of studies done, so we know a lot about it. But then we have the disadvantages of antibiotics, that they can cause very much adverse events. They are very difficult to find new ones. They also have like the antibiotic resistance. So if you see it all together, you can see that they really work on opposite sides. They're really contrary to each other. So phages can be used as an alternative to antibiotics, but they can probably be used together, so that phages and antibiotics will work together. For instance, you can give a phage to a patient, so the biofilm is destroyed, and then an antibiotic can be used to destroy the bacteria as well. So it's not one or one. They can be used together. The strengths of the phages and the strengths of the antibiotics can be combined together. So, but what is the efficacy of phages? Do they really work? Well, all right. So there is one study that we did. So we really had a look in the literature, and it was a little bit disappointing because we know all the years from the phages that are given in the Eastern countries. Well, we don't know a lot of it actually, because these studies, they were not published. They were in Russian. So all these data, they're not on a computer, where we don't know anything about it. There were only like 50 case reports and case series published, but these were not clinical trials. They were just like, yeah, so we have a patient with a severe infection, we give them phages, and then we see if it works or not. So we don't really know a lot about it. But these studies, when we take it all together, we can see that it's safe, it's causing no side effects, and that it can be used. But we should be doing more and more research to really have an idea on the phage therapy. So this is already my last part about the phages. I would like to end with a small case study that we did. So we treated a patient in our hospital, and I just want to go through it with you so you have an idea of how it works. So this is like a typical case of a patient treated with phages. So it's an 80-year-old man who had a polytrauma in 1977, so it's already a long time ago. And he had a femur fracture, so he broke his leg, and he developed an osteomyelitis on it, so an infection of the bone. He had multiple types of antibiotics, orally IV surgeries. He's had done several of things, but it wouldn't go away. And then March last year, he was referred to our center just to ask what should we do in this patient, because he's tried everything for all these years, for more than 20 years, what should we do? Here are some pictures. So he has, this is what we can see on the outside. So he has like a femur, so osteomyelitis with chronic fistula formation. So here you can see like the holes of the fistulas, and there's always like pus coming out of the fistulas, and then they close again, and then new ones come. Here's a picture of the X-ray. So here you can see on the leg that there is really severe osteomyelitis. So they also took like a bacterial strain, and they saw that there was Pseudomonas aeruginosa inside of it. And now there was really like, what should we do? So the question is, can we treat this patient with bacteriophages, or should we amputate his leg? Because that was really the only possibility. So we decided to treat this patient with phages. And this is how it looks. So what happens? So in these patients, they first do a surgery. So they really drain all the pus, all the inflammatory tissues, and then they place like a draining system. So here you can see the draining system. It goes inside the femur and it comes out again. And then they rinse the bone actually with bacteriophages. So here you can see the syringe with the phage solution. So it's really, it's a liquid containing the phages. And then they rinse it, and then afterwards at the hospital unit, they just leave a draining system and they rinse it every day for 10 days only. So not longer than 10 days, because then the drain is removed and then the surgery is actually done. The patient also gets antibiotics, but that's not something he hasn't tried before. So it's really an additional treatment within the antibiotics. And what happened? So his Pseudomonas aeruginosa disappeared. So the fistulas closed, the Pseudomonas aeruginosa was gone, and also even 12 months after the treatment, there was no recurrence of the infection. So this patient has tried 20 years several types of antibiotics, IV, etc., and it didn't help. And then 10 days of phage therapy with antibiotics was a solution for these patients. So this is really a very nice case of how phages could be used. There are several other examples available also in our hospital, but also in literature, that are showing these beautiful effects. Well, we don't know a lot of it yet, so we really have to study it more, but it's really something that could help with this battle against the antimicrobial resistance. So that was it for me today. I have some take-home messages left. Okay, so be aware that antimicrobial resistance is one of the biggest threats. We know everything about COVID, but don't forget that there's still another big issue, the antimicrobial resistance. We don't know a lot what to do about it, but these phages could be useful to treat these infections. We know that it's safe and it sounds promising, but we have to do more research about it. But hopefully this can help scientists and doctors to really treat their patients well in the futures. So if anyone has questions, please let me know. And then for now, I would like to thank you very much for your attention.
So, does anybody have some questions for Dr. Uyttebroek? Yes, we have a couple of questions. Speak loudly in the microphone, please, so that we can understand your questions.
Hello, thank you for the interesting information. I wanted to ask if there comes a time where we use bacteriophages as a first-line treatment, do we always have to do a culture, or could we also use it if we have a really good suspicion that it could be, for example, in a meningitis, we have a suspicion that it could be meningococcus or pneumococcus. Could we use them without a culture, or do we always need a culture first? Thank you.
Yeah, very interesting question. So it's really depending on the country that we use the phages. So in Belgium, we can use these magistral phage preparations, but in order to be able to do this, the patient has to undergo several steps. So first, there should be a culture taken to be sure what type of bacteria is causing the infection. And then we usually send these phages to our Belgian Iliava, so at the military hospital. And there they check if they have in their library a phage that can infect the bacteria. So there's really one phage, one bacteria that have to be combined. So it's really necessary to have a swab or a strain taken. So that's very important. So there are different steps. So right now, as a first line, it's not possible because we have to, we can only treat patients that are really resistant, that are really recalcitrant to all treatments. So they have to have undergone several courses of antibiotics. So for now, it's not possible because they're really strict in which patients we can give it. But maybe in the future this will change. But it takes a lot of time for processing, also the regulatory, the ethical. So it's really difficult for giving patients the phages right now. But maybe in the future it will be possible, as they do in Eliava.
But which means that for the moment the process is 100% locally based. You can do everything in Belgium. You don't need to go abroad to have the analysis and the comparison.
Yes, everything can be done in Belgium. Yeah, because we also get a lot of requests from patients from the Netherlands, from France. They want to treat patients, and then they send us an email. So, can we treat these patients? Can they come to you? So it's really something that we can in Belgium is really unique.
Famous.
Yeah, it's unique.
Okay, nice database from our country. Do we have other questions, please? I saw other raised hands.
So a question for you. Everyone heard about mRNA during the pandemic, and it's more than 50 years of innovations to come to a truth. What do you see as a next generation of phage to be able to be applicable as a more broad treatment in the future? So can you tell us a bit more about what is your thinking about new innovation that might accelerate the use of phage in clinical studies and as a treatment?
Yes, so setting up a clinical study is a little bit difficult because, yeah, with the regulations, it's not ethical to do a study in patients they really need a treatment. So, for instance, this patient, he would either lose his leg or do the phage therapy. So it's really difficult to set up a clinical study by the ethical committee with it. But there are some companies that produce commercial phages, so it's not the military hospital, and they can set up these studies. So that is really difficult. So what we do is we treat these patients, we collect the data in sort of a database, and so we can tell something about it, the efficacy, but it's not really like a randomized control trial that we do. So,
next question.
Hi, I would like to ask if phages can be designed against any type of bacteria, or is it limited?
Yeah, that's a good question as well. So it's possible. So normally for each bacteria there is a phage available. Sometimes it's a more difficult research that we have to, as I already said, go in the ponds, in the hospital, in the wastewater to really look for phages. But normally for any bacteria there is a phage available in theory. But to be able to apply phages to the patients, they have to have a passport. So it means that these phages must be well studied. They must have like a sequence that we know everything about them, the mutations and stuff like that. And when they have a passport, we can treat the patients. So for now, we have mainly phages available for Staphylococcus aureus, for Pseudomonas aeruginosa, and some other. So I think there are 10 phages or something that we can give to the patients. So not for right now, we can't give it for every bacteria, but that would be the future plans.
Thank you. I saw some other hands. Yep, let's. Oh, it's all the same row, nearly.
Is there a risk that the phages get mutations and that causes them to go against bacteria that are already in our body, that are functional, and even in a later stage, maybe against human cells?
Yeah, so that's a really good question. I didn't put it in my presentation because we don't know a lot of it yet. So phages are viruses that you give to a patient. So as we see with the COVID vaccines, people can produce antibodies against it. So it is possible when a patient gets several courses of bacteriophages that they produce antibodies and that the treatment also will not work anymore. So that is one part, the antibodies, but we don't know a lot of it yet. We're also looking at it right now. And then there's another type, so it's possible that bacteria can give mutations so that the phages will also become resistant. So that is also something that might be possible, but we also don't know a lot of it yet. So these are the two mechanisms that can cause also in these phages that they become resistant. So the bacteria become resistant or the body becomes resistant, but we don't know a lot of it yet, but it's really important to know.
But it's like the term phages, instead of using the word virus, a way to combat, the negative connotation of the virus, because when you hear virus, you think about negative.
Yes, yeah, it's really funny because when you say to a patient, well, we have an alternative treatment, and it's really with bacteriophages, which are actually viruses, and they're like, oh, you're gonna give me viruses, right? Yes, so that is really important that the patients will understand that it's really something that only attacks the bacteria, it will not harm the body, and that is really important for them to understand, especially after the COVID pandemic.
Yeah, so now the terminology is like phage is the positive, and virus is like, even though it's the same.
Yeah, I must say that I don't mention a lot that it's a virus to the patients, because otherwise they can be frightened a little bit.
Too many movies. Too many movies. Okay, next question, please. Up front. And maybe you'll have both the same question.
Oh, I'll get up. Thank you, yes. Hi. Coming back to a question that was asked before, so from what I understood, the reason we're not using phages more in Europe and the USA Hello? Oh, okay. Is because we don't have...
Wow, you're good. You can actually turn up the mic.
Sorry. Okay. So it's because we don't have enough research about it, but from what you told us at the beginning of the presentation, phages have been used in other parts of the world for a few tens of years. Why can't we use that research, for example?
Yeah, that's difficult. There's not a lot. So in Iliava, they treat patients with phages, but they don't have a lot of studies that are published, and if there are studies, they're in different languages, very difficult to get them. Also, they also published like a data, so they published an article with all the patients that they treated, but for every patient they use different protocols, they use different phages, different treatment applications, some of them get IV, some of them oral, so it's really So it's really hard to draw strong conclusions with it. So the most difficult right now is that it's really difficult to implement it in a country because of the interaction of the ethical thing that is with it. So we don't know a lot about it. We give viruses to patients on one hand, and then also that, it's not every country has its own phage laboratory or phage biobank, so it's really an entire process to build something like this. Also in Leuven, the Phage Force project, it took a couple of years to really start with it. So it's not so easy to start it.
So I was wondering, do the patients that receive this kind of therapy, they have to go under some kind of protocol to be isolated for in the long term, preserve the benefits of it, and like in the resistance of, that's a little bit of a messed up question, but the question is, do you have to put your patient in a special space to prevent mechanisms of resistance on the long term?
No, so it's not needed. So in Belgium we give the phages locally. So we have in Leuven for each treatment indication. So for instance, we have the four: the pulmonary, the sinuses, the musculoskeletal, and the sepsis. We have treatment protocols. So usually they can just do the treatment at home. So they don't have to stay in the hospital to do it. The patients that undergo surgery for their musculoskeletal infections, they have to stay until everything from the surgery is done and they're healed. Then they can go home. But for instance, I do the patients with chronic sinus disease. They just can do the entire treatment at home. So they also don't need to be in isolation or something, because we also give it locally. And a phage needs its bacteria to be close. So if I sit, for instance, next to you, you don't have the bacteria, so the phages won't do anything. So it's really not necessary to do it.
Oof. Other question? Down there? Onze Nederlander. You are not alone, my friend. I know there are other Dutch people.
Okay.
I don't know where, but you're not alone.
Hi, I came in a little bit later, so maybe I missed it. But how long after the treatment, how long does it last before the phages are cleared from the system?
Well, that is very difficult to predict because the phages, they work according to the number of bacteria that are present. So when there are lots and lots and lots of bacterial cells, then the phages will amplify exponentially. And then when the bacteria gets reduced, the phages will disappear from their cells. So it really depends on the density of the bacteria. So it's really hard to predict. We don't have a lot of data about it. So it really depends on the level of infection. It's for each person, it's different.
Okay, thank you.
It's really another way of thinking. It's not as like you take a tablet of antibiotic and you know how long it will last. It's really a totally different world that way.
Oh. So injecting bacteriophages, it's like injecting a foreign antigen into your body. So would you have to add like immunosuppression therapy for the patient, or might that like expose the patients to future infections?
Yes. So. No. So we don't inject. So we only treat patients locally. For instance, we rinse an infected knee. We rinse the nose, we do aerosols in the lungs, so it's really a local treatment. In Eliava, they use phages orally a lot, or also injecting it. We also do it for sepsis, but so it goes into the body, but not in very high numbers. So it really stays locally where the infection is located, in the knee, the nose, etc. So it's not necessary to. The body will not react that much to it, that immunomodulatory drugs are needed. And also, we wouldn't know what will happen when the immune system doesn't work, what the phages will do then. So it's not necessary to do it, no.
That's good. See, so many questions,
yeah,
right?
I see.
Hello, good afternoon. I was wondering if phages are only used to treat bacteria or could maybe be used to target other type of cells. I'm thinking, for example, cancer cells or other diseases.
No, so the phage really needs its bacteria, so it will not bind. The bacteria have several receptors on which the phages can bind, so it will not work in other types of cells.
And be modified in the laboratory to make them more specific of other type of cells?
What they're also working on is before that the phage can burst the bacterial cell, they produce enzymes. So now what they're doing now is instead of taking the whole phage, they only isolate the enzymes, but that's also for treating bacterial infections. So they use different components of the phage for the infections, but it's not at this moment used for other purposes, and I don't think that it will be possible because of the way that phages work.
Do you think later, when we will have done all the research and we will have all the data, do you think bacteriophage will totally replace antibiotics?
Well, in the beginning, we wanted to do that the phages could really replace antibiotics, but the more and more we get into research, we see that the strongest weapon will be the combination of antibiotics and phages. So phages by themselves, they can do a lot, but it will be the best weapon will be the combination of the two, so that the bacteriophage really opens the way for antibiotics and the other way around. So they will be needed together, probably.
So we'll always have use of antibiotics, knowing the antibiotic resistance growing phenomenon.
Yeah, because we do believe that the bacteriophages will be able to reduce the resistance of bacteria. For instance, the patient that I showed had a Pseudomonas aeruginosa infections, and we know that this bacteria really can cause a biofilm. When we look at the the antibiogram, we saw that there were still some antibiotics that were sensitive, so it's really not multi-resistant. And what would be possible is that the phages really destroy the biofilm and reduce the loads of bacteria, and that then the antibiotics can come and then they resolve all the rest so that they can really work together.
But is it like the combination of the two could lessen the use of, you know, the quantity of antibiotics?
Yeah, because then when it's just imaginary, but then the duration of the antibiotics will be less, the doses will be less, so that will cause, it's possible.
Two weapons more efficient than one, and so using less time.
Yeah.
Okay, that's good.
I have a question about the study that you said was done that was not so successful. Considering we know all the case reports are very successful stories, what do you think is the reason the study is not showing that?
So the study, you mean with the table with the green and the white?
Okay. You said there was a study that was done,
so
but it wasn't very significant.
It was really, we looked into the literature and searched for all the possible studies that were carried out in the field of phages. So we checked it from, I think, 10 years ago until now, what data is available. And there were only 50 studies, so that's not really a lot. And most of them were case studies, lots of cases. And they, as I said, so in one study they use this type of phage, they do it locally in a patient with Staph aureus. Then another study shows another bacteria with another phage, with another treatment, and then another concentration. So it's really difficult to make an overall conclusion because everyone is doing something else. It's really, we don't know a lot of it, so it's like, what should we do? How should we treat it? What course? What concentration? So
there is no randomized studies.
No, there's not a lot of them, and there was one big study, the Phago burn study, which was really a trial that was set up as it should be, and then they saw, it wasn't as effective as we wanted it to be, and then there was something with the concentration that it dropped sooner than they expected, so it's really difficult as well to...
Okay, thank you.
And unfortunately, already the last question, but Dr. Uyttebroek is going to stay a little bit, so if you have other questions, feel free to ask her. Please stand up.
Hello, thank you again for all the informations. Well, I have kind of two questions, so we'll see. Can anyone participate? Are there some contraindications?
Well, I think not really contraindications, but in Belgium, the patient has to do a lot of steps before we can apply the phages. So I see that there are lots of patients that drop out because of the rules that are needed to follow instead of that there are really contraindications. And that is the main reasons are, for instance, that they have like a bacterial infection in which we don't have a phage. For instance, Klebsiella infection. We don't at the moment we don't have a phage for it, so that can be a reason. Or when there is no phage that is working, for instance, the Staph aureus, we do have phages for Staph aureus, but sometimes they don't match. That's also a possibility. Or when a patient, we did. There was one patient with like a hematological cancer, in which the blood cells were not perfectly controlled, and then we didn't do the phage therapy because we didn't know what would happen with the immune system. But it's really discussed in a group of professors. It's each patient individually that is looked at, so we don't really have a list of contraindications, but it really depends on the patient actually.
Thank you. You have actually answered also my second question.
Perfect.
Thank you so much.
Well, thank you so much, ladies and gentlemen. We unfortunately have to stop the live streaming now, and so let's give a big round of applause for Saartje Uyttebroek.
Thank you.